Jean-Paul Soucy, co-founder of the Canada COVID-19 Open Data Working Group. Jean-Paul, great to have you on the program.
Thanks so much for having me.
We were talking, of course, about long-term care homes, as you heard me speak about there. You and I have talked about this UK variant. Now it's been confirmed that is what has been causing the spread in this long-term care home. The number is just extremely high. Talk to me about your concerns here.
Yeah, I think if we see this become more widespread, then it's based on some modeling data I've seen, it's quite likely that just at a time in the spring when we'll be starting a more widespread rollout of the vaccine, it's quite plausible that we'll see a third wave that's driven by the increased transmissibility of these new variants.
Testing has also been extremely important during all of this, and you and I have talked about that. There is now some breakthroughs with regards to testing in this country. Spartan Bioscience, their rapid test has now been approved by Health Canada. They've tweaked it. They've made sure that it is fully accurate. Your thoughts here, this could be a game changer.
Well, I think rapid testing is very important and certainly a tool that we've underutilized up to this point in Canada. We've seen it effectively used in places like Nova Scotia. I certainly hope it becomes more widespread in here. We could certainly use it more widely in long-term care and on the border as well.
What about in schools, Jean-Paul? We know that Montreal, for example, 2 high schools in Montreal will be doing a pilot project of testing. I think about 25% of students and staff. What about having those available in schools?
Yeah, absolutely. I think in any environment where you can have these rapid and far-ranging outbreaks like schools or long-term care or even healthcare facilities, if you have frequent testing, that can do a lot to prevent those large outbreaks from happening. And in many ways, the frequency and rapidity of the tests are just as important as how sensitive they are to picking up every last case.
And certainly could make a big difference, of course, when we're talking about travel at airports. And we know that Ottawa has been putting some travel restrictions. They've been warning. We heard from the Prime Minister yesterday telling people, regardless, you need to stay home. Don't go anywhere. Don't even go anywhere, outside of your province, for example. So your thoughts on there? We could potentially have these test units used in airports or in areas of travel. But again, that messaging to say, we know it's difficult, but just don't go anywhere.
Yeah, I think the messaging is important, but I think the policy is very important as well. Yeah. We've seen, with regard to this new variant, the UK variant or the B117 lineage, we've seen several instances so far of a failure of quarantine to actually prevent the spread of these in visitors coming back from the UK, spreading this in the community. And so I think we do need to consider more strict and more severely enforced quarantine measures for returning travelers as well, since this seems like a really strong, really powerful way to prevent us from spreading this variant more widely and more quickly. I mean, obviously it's already here, but certainly the longer we can hold it off becoming widespread, the more time we have to ramp up vaccinations and get us to the summer as well.
Quickly, before I let you go, I've got just a few seconds here, though. That, of course, as we're trying to curb the spread, we're also doing our best to help our frontline care workers, doctors, nurses who are in hospitals that are being inundated. 2 new field hospitals we know are coming to Toronto now. It's interesting to hear that, considering that we have to get to that level now. But talk to me about the importance of that, how it might be able to help, and then maybe looking at something like these in the future.
Yeah, so new infrastructure, it's helpful to relieve some of the strain on hospitals, especially considering that, having to manage a very infectious virus within the hospitals means you have to kind of rearrange how you have patients, separating those who are infectious from those who are not. So that will help. That being said, we also need staff, and staff in many places are in short supply, especially since, now we have the demands of vaccination. We have doctors being asked to help manage long-term care outbreaks. So certainly that is a huge pressure, and unfortunately new infrastructure can't do anything to solve that.
Yeah, well, we're keeping a close eye. Numbers a bit down today, of course, in Ontario and Quebec. But again, we know based on your research, the numbers can go any which way. Jean-Paul Soucy, co-founder of the Canada COVID-19 Open Data Working Group. Always great to have you, Jean-Paul. Thank you again for this.
Thanks so much for having me.
You're welcome. Still ahead, U.S. President